Okay, so I'm here with Dr. Stefan Cavallino. He's the director of the European School of Prolotherapy. Best guy ever. I found him online. And I was desperate because I had pain in my lower back and while sitting, while sleeping, and I found out it was the SI joints. And Dr. Cavallino, what did we do to help the joints?
Well, your body was unstable. There were many joints that needed to be understood. What was causing the joint irritation were the ligaments that were unstable. And the ligaments, not many physicians know that ligaments are so important to keep your body strong. And so since they were weak, we treated them by doing some injection therapy, which is very simple, safe, and using a natural solution. We don't use drugs. I use dextrose or glucose, and a little bit of anesthesia just so you don't feel the injection.
It didn't hurt too much, yeah.
and you should resolve your problem. It might take 3 to 4 treatments. I mean, low back pain is what we treated, your SI joints. And, you come here with an MRI showing that you have disc disease, a protrusion, a herniation, but that's not the real major cause. 70% of the patients that do have back pain is not due to the spine, it's due to the lower area, which is your lumbar sacral area, and that was what we treated with you. So I feel that you're going to get better, and that all your friends that have these problems can probably understand it. Now I treat the whole body. I don't just treat the low back. I treat
shoulders and like knee, do you treat tennis elbows?
Elbows, everything. Every part of the body is being treated now to understand that the ligaments are what makes the body weak. And that's why you have pain, because the ligaments have to have their time to rest. And when they're not resting because they're overfiring and then you have continuous pain, then who's going to help you is usually you take anti-inflammatory drugs. And these drugs are just going to take away the pain, but it's not going to help the problem.
Yeah.
So by doing these injections to regenerate, and this is why we call this regeneration medicine, we're regenerating the ligaments, and now the tendons are finally working better, so your whole complex, your joint becomes stronger.
Okay, and does it matter how old the person is when you're helping them with?
That's a good question. I even treat children. People that have kids that have knee problems, a jumper's knee, and they can be between 8 to 10 years old, and I treat them as well. I do also neuroprolotherapy, which is to treat the nerves.
Yeah, how does that work?
I use a dextrose solution. It's at 5%. I treat that. It's a subcutaneous injection, and I treat the nerves. I go just to follow the nerves, the sensitive nerves that are causing the pain.
That was what you did today.
Right. Yeah. Just to give you an example, if you were to come into me with you had a trauma to your thoracic area and you have a broken rib.
Yeah.
I would treat the nerves along that rib, and that pain would go immediately away. But if you were to take any type, even morphine can't get rid of that pain. But because I'm treating the nerves, and remember that the nerve becomes insulted, becomes damaged when you have an injury. Okay. So if we fix the injury of that nerve is going to fix the injury of that muscle, and it's going to fix the injury of that vein, and everything else is going to work properly. So neuroprolotherapy is very, very important that I did do this to you.
Okay, and if anyone wants to connect and ask questions or even come to one of your courses, how can they find you?
Well, thank you for this invitation. All doctors that are interested in learning injection therapy, especially with this natural future potential for all pain management doctors, but that doesn't mean that they have to be a pain management doctor. You could come to me, even if you're a general practitioner or you're a gynecologist. We have everybody. And we have a teaching system here. It's once a year. You get 3 courses in that year, and then you get to come with me to either the United States or to a European country to do a prolotherapy mission. And that's all up to you guys. Whoever wants to come, you're invited. As long as you have an MD license.
All doctors, okay.
Yes. And physical therapists that are interested, we're always interested in helping them understand prolotherapy. And of course, if your country wants to learn prolotherapy, we can organize a crew to come over and teach it. So we don't have to have everyone come over here.
Okay.
All right?
Thank you very much.
Good. This was nice. Take care, guys.
All right.
And all you patients that need me, come to Italy.
All right.